The main indication for hip replacement is hip joint arthritis, and probably about 90% of all cases are done for this reason. Some patients are being operated due to post-traumatic arthritis. If some trauma occurs and some fixation being done, eventually arthritis might develop. Also, part of the patient are being operated due to aseptic necrosis of the femoral head, due to blood flow circulation disturbances. Femoral head collapses, and there is no conservative treatment option in those cases, and those patients have to be operated and the hips have to be replaced. Surgery usually is done under spinal anesthesia. We operate here via posterior approach with a soft tissue preserving technique, not cutting any muscles. And first we expose acetabulum, and using creamers we remove remaining of the cartilage. Afterwards we prepare the femur using a special rasps which form the canal of the femur according to the stem. After the acetabulum part is prepared, we implant cup. Can be either cemented or uncemented. In case of uncemented, we use press fixation. Then the cup is put into the acetabulum, and due to rough surfaces of the metal, bone attaches to the cup and eventually grows into the surface of the implant. While for the cemented option, we prepare the bone to make the spongious bone open, do some holes in the bone and insert cement, and after we implant the acetabular cup using cement, and cement fixes the acetabular cup in connection to the bone. While for the stem, we prepare, after the canal is prepared, we put the stem. The size is already pre-shaped according to the patient's anatomy features. And after the stem is implanted, the final step is mounting on the femoral head. And after, hip is relocated into its original position, and we check the range of motion, check if any risk of dislocation exists, and afterwards the wound is closed. Patient's recovery is individual, but there are some rules. Next day after surgery, patients can walk using crutches. After their discharge, it is recommended for patients to have some rehabilitation, at least 7 days. During this rehabilitation process, we strengthen their muscles, teach them how to walk normally, give them some exercises. Fully return to normal life is about 6 weeks after surgery. So the recovery after hip replacement is kind of, as compared to the knee, it's much faster. There are a few complications which are related to the procedure. One of the complications is wound infection. The rate of this complication is not very high, it's below 1%. Other complication can occur, it is dislocation of the implant due to unallowed movement which patient does due to some trauma after the surgery. Also can be periprosthetic fractures. But if you look in general, the total risk of complication after hip joint replacement is less than 2%, so it's not very high. And there are late complications, so-called aseptic loosening and instability of the implant. Those complications can occur 10, 20 or 30 years after surgery, but yes, they can also occur. Patient can put full weight on the operated leg the same day as surgery is done. At least 3-4 weeks. Patient can drive in about 2-3 weeks after surgery. From 6 weeks to 2 months. There is no any indication to use any kind of braces after hip replacement surgery.